books, editor for 5 books, and chapter contribution for 4 books. Sir has more than 170 research publications in national and international journals. Sir has more than 25 extramural and intramural research grants, 7 non-funded projects. Sir has completed more than 15 national and special assignments and delivered more than 13 keynotes. Sir has been chaired more than 60 sessions at national and international conference, seminar, and workshops. Sir is having more than 16 national and international fellowship in many prestigious universities, societies, and associations. Sir has fellowship with certification with various esteemed organizations, especially University of Melbourne, Australia, Global Nursing Leadership Institute, Scholar at Global Nursing Leadership Institute, Geneva, University of York, United Kingdom, Hospital Administration and Management at National Hospital, University Hospital, Singapore, University of California. Sir, we welcome you.
Our next felicitator is Dr. Raman Kalia ma'am. Ma'am is working as principal in Saraswati Nursing Institute, Dhyanpura, Punjab. Ma'am has excellent experience of more than 40 years. Ma'am has done Masters in Nursing in Medical Surgical Nursing from PGI Chandigarh with Best Thesis Award, honored with Gold Medal for the same. PhD in Pediatric Surgery from PGI Chandigarh. Ma'am has authored more than 5 textbooks, Editor-in-Chief Nursing Research and Midwifery Journal, Chairperson Board of Nursing Studies, Baba Farid University of Health Sciences, External Examiner of various universities and member of professional bodies. Ma'am has WHO Fellowship in Thailand Children Daycare, is also founder president Nursing Research Forum PGI, and also has published papers in various nursing national and international research journals. Ma'am, we welcome you.
Next panelists are Dr. Dipti Shukla, her designation working as principal, Samparan Institute of Nursing and Paramedical Sciences, UP. Her qualification, PhD, MSc, Post-Basic Nursing, Postgraduate Diploma in Human Rights from Indian Institute of Human Rights, New Delhi. Her award, she received award for Innovators Award for Industrial Design as developed by KD Vagina Reflectors and got registered in Patent Cell of India and Swami Vivekananda Subharati University. She also received Innovators Award for Industrial Design developed by postpartum abdominal binders. Her achievements, examiner at various universities, appointed inspected by State Nursing Council, Lucknow. She has 6 publications in international journals and many more. Her membership, she holds the membership of prestigious nursing institutes such as TNAI Society of Midwife Nursing and Nursing Research Society of India. We welcome you, ma'am.
Our next felicitator for today's panel discussion is Dr. Binu Joy, working as principal at Christ College of Nursing, Christ Hospital, Gujarat. Sir is having BSc, gold medalist in MSc Nursing with specialty child health nursing, MBA in hospital administration, PhD in nursing, and also has diploma in naturopathy and yoga. Sir has given more than 17 years of experience in the field of nursing. Sir has published over 20 papers in various national and international journals, published textbook on child health nursing for GNM students, textbook of nursing research and statistics for BSc nursing students, as well as cumulative record book for BSc nursing students, and solved question papers, booklets for foundation and child health nursing. Sir has membership of various professional bodies. Sir has been resource person in more than 10 state level and more than 13 national level conferences. Sir has more than 5 paper presentations in national level conference and also editor for more than 5 national and international journals. We welcome you, sir. Now we'll start with our panel discussion. Over to our respected dignitaries and felicitators.
Good morning, everyone. We are going to start the panel discussion on forensic nursing examination, including photo documentation. I welcome all the panelists with me, Dr. Suresh Kumar Sharma ji, Dr. Raman Kalia ji, Dr. Deepti Shikha, and Dr. Binu Jo. We are here so that the theme of this conference, advanced practices in forensic nursing, and especially the forensic nursing examination, you become clear about that because there are so many different aspects to the forensic nursing examination. Forensic nursing examination becomes a very broad term, and probably with each specialty, the things are going to be different. But for a general forensic nurse, a generalist forensic nurse, the things will remain the same, whether it is the psychiatry department, whether it is the trauma, whether it is abuse, whether it is violence, or it is a criminal matter. So whatsoever the things are, the examination of the victim, examination of the offender, they go hand in hand. And if we have done the examination correctly, we have collected the evidence properly after assessing, then probably majority of the things for the prosecution is ready. And it is not only examination, it is also handing over all the evidence to the concerned persons. Usually it is through the police in most of the countries. And the most important thing is when you collect the evidence, it should be collected in such a manner that it does not become weak. It is not considered as a weak evidence while the cases are being prosecuted. And there, we should not do anything which weakens the evidence. Maybe we have collected it in a very good way, we have preserved it in a very good way, but when we are handing it over to the police, then we forgot something. We don't take their signatures, or we don't know their details. So all these things we are going to discuss. And in addition to this, yesterday also we were talking about this, and during all the lectures, the various things have come forward, that whenever these things are being done, these needs to be done in an ethical way. So there are some certain guidelines But we need to develop the ethical guidelines for the forensic nurses in India. So that is should be a priority, because unless we do the things in an ethical way, we don't get respect in the society. And if the society does not accept us, probably we can't do much for the society. So acceptance is the first thing, which should be the top priority in our mind. So we are the 5 persons sitting here, and I will ask everyone to give their views on this, and I think the best thing is to start with the ethics, because ethical considerations are very much important. And it is good for the patient, it is good for the society, and it is good for us also. So I will ask the ladies first. So I asked Dr. Deepti Shikha to start with this, and then other persons will follow you.
Yes, sir. Thank you so much. Before I start, I just request for the slides will be visible from backside when we're discussing. Jai Hind, thank you so much. As with me, there are the galaxy of gems from nursing. I'm blessing to be with Dr. Sharma, and Abto, you becomes a role model for me. Dr. Joy, and yes, I have seen her in the books only. Today she is with me here, Dr. Raman Kaya, madam. So yes, when we are talking about the nursing, so we do have ethics in nursing, but as I discussed with sir, we don't have ethics in forensic nurse. And though it is so long working in outside of the India, but we don't have, as I didn't found, and I already discussed with you that we don't have ethics in forensic nursing as such. But Indian Association of Forensic Nurses, they have given some guidelines regarding that. On that basis, they are following the ethics for the nurses. But when we are talking about the ethics in forensic science, there are 4 or 5 points which I would like to just mention in PPT and the others. That yes, we all as the nurses and the doctors and who is including in this forensic science department, they are following these ethics. So as they have written, the first one, maintain the integrity of evidence of your qualification. So who you are working with the forensic department, that you must explain the things and very clear and honestly you tell that your qualification is this, and yes, we are working for this forensic science. Second, they have said true and accurate representation of data. Since yesterday we are listening, sir also focused on that data must be accurate. So second point they have raised for the ethics in science, that the data must be represented accurate. And the fourth, they have said clear and complete documentation. We cannot leave a single point or avoid the things in the forensic science. Each and every point is very important. So that means each and everything must be documented. And the next, they have said impartiality of the testimony. Whatever is there, you must be impartial for all the evidences. That must be clear, must be clearly documented. And then confidentiality is a very important role in the field of ethics. And reporting of to the colleagues if anyone is violating the rules. Next slide लगा दीजिए. Ethics in science वाला आप लगा दीजिए. Yes. No. Already it is finished. Next. I cannot see from actually. Ethical. No, just before this, 4th slide. I am not able to see. आपको दिख रहा है, मुझे दिख रहा है. Yes, thank you so much. Thank you. So here, ethics in forensic science. So So already it is clear and complete document is important in every field, not even in ethics. Whenever we are working in the clinical and others in the education department also, documentation is an important point where we have to work a lot. So a clear and complete documentation is really very important. They have put it in the ethics of the forensic science also. Then impartiality of the testimony, we must be impartial for every event where we are focusing for the forensic department. Confidentiality and disclosure, both the things are there. We cannot deny anything, some mistakes, anything, whatever we are finding in the field of forensic. I'm just talking about forensic science, not in nursing. So reporting of the colleague who violate the profession's ethical code, this is not changed. It is same to same as it is mentioned from the forensic science department. If anyone, colleagues of yours is working or violating the rules of forensic science, you must report that. This is also a responsibility for the person who are working with the forensic science. So here, on the basis of that, Indian International Association of Forensic Nurses, they provided some guidelines already. Gairia said, these guidelines are only following the outside India in the field of forensic nursing. We don't have written or documented forensic nursing ethics. So, we need to start on this for the forensic nursing ethics. They said healthcare provider must to determine the best for them. In nursing also we are saying patient rights are important. Only one word, patient and patient rights. Here also patient's rights are important when we are working. So that means that the nurse who is the forensic nurse must honor the right of patients and they must deliver the fair and equitable treatment to everyone. Means we must not be partial for anyone. This is my no, neither any empathy is there, any sympathy is there, and we are saying that we must impartial for every aspect of the forensic nursing. They should work and promote the well-being of the patients. Yes, we nurses, we are always working for the well-being of the patient. In the forensic also, the same thing is that we have to work for the well-being of the patient. And they should obligate and do not harm, including providing the effective treatment. Everywhere in our ethics also, we are saying we have to go with the right route, right dose, right. Yes, these are the things there. Here also we have to obligate, we are not going to harm any patient with our disease. We are not supposed to harm anyone and direct forensic nurses to deliver care to the loyalty and the honesty. Honesty and loyalty are the role of the caregiver and the nurses also. It is already mentioned, following, all nurses are following that we are loyal and honest with our patients. And next they said the nurses who are working with the forensic science should advance the science and the field of forensic nursing and understood the limit. Yes, here in India, last day madam from Kashmir, madam is here, she said we are limited everywhere. We are talking about the ethics, everywhere we are talking about the ethics and nurses are only in the boundaries. We cannot cross the boundaries. Others can cross the boundaries, doctor can cross the boundaries and paramedicals can cross the boundaries, but nurses cannot cross the boundaries. We even cannot write a single medicine, though the INC has introduced NPCC, that course, nurse practitioner course they have introduced, but they are also not following the correct rules for this. Everywhere they have given 20, 30, 40 seats, but they are also not having any rights to write. They are even not writing. They are not that much confident, we can say, that they are not getting proper information and guidelines for that. Here also when the forensic nursing is there, we are bounded with everything. We are all, means lastly we are talking about the jobs and everything. What about the ethics? First, please allow us to work confidently and little bit in open environment. Everywhere within the boundaries. Here also they have put it, you must work within the boundaries. So yes, here also we are in the boundaries. So we need to cross these boundaries to come up as a forensic nurse. This is the first requirement in India. Then they work in the number of specialties. Yes, here sexual assault nurses, child abuse, neglect, human trafficking. We need so much to work in India for these type of specialties. Where the specialties in the MSc nursing, we are having med-surg, obs, gynec, pediatric, and we are not allowed to work with our specialty in the hospital because doctors are not allowed. We are in the boundaries. So we need to cross the boundaries to get this forensic nursing as boundaries are there also. So nurses need to grow, need to understand, need to find out their own way to work with the forensic, not only with the forensic, other things also we need to know. So these are some guidelines for the International Nursing Forensic Nursing Department, and these are only the ethics. We are still following that. In India, we need to develop ethics for nurses. Thank you so much.
Thank you, Dr. Deepti, for highlighting the need of the ethics and how this should be done by everybody who is in the field of forensic nursing science. And probably, I think we need to develop the ethics for our own country, because we have different problems. Every country has its own problems, and general things are there, but especially what is relevant more to our country, we need to go for that also. And I hope in the coming years, we will work together and develop in a very good way. Probably the guidelines can be issued from the Indo-Pacific Academy of Forensic Nursing Science, because most of the members are from India in that organization. And ultimately, we can develop that, because if it is by some organization like International Association of Forensic Nurses or American Nursing Association or anybody, so that gets more value as compared to our individual, what I think,
Yes,
or what somebody thinks. But if it is a collective effort, probably that is given more weightage by
It is
anybody.
coming in future, as such said that it is in the pipeline and the guidelines are there. Definitely this ethics will come, but at the current time we don't have that ethics.
Yes,
This
yes.
is only my point. So
Yes.
definitely in the future we'll have.
Yes, so that is why I was saying that we need to develop it we need to develop in India. We need to sit together, and we need to develop in India. Now, I will request Dr. Suresh Kumar Sharma ji to shed some light on the forensic nursing examination. We can take the first, this one, and then photo documentation. So I think going in the sequence, it is Dr. Binu Jo, he will speak on the forensic nursing examination, and then Dr. Sharma will will talk about the photo documentation of the evidence.
Thank you, sir. First of all, very thankful to all the organizers. This place is such a eternal. Yes, this place is eternal. It's a place of divine. And I hope no forensic cases lands up here. Yes, but forensic, yes, violence is increasing day by day. And we are coming across various sorts of violence, whether it may be physical, mental, the well-being of the individual is affected. So forensic nursing is a department which looks after the cases of criminal cases, whether maybe in the form of sexual abuse, child abuse, elderly abuse, domestic violence, and strangulations, etc. So nurses working in the emergency department will come across various cases of forensics, maybe of sexually assaulted, injury victims. Now, specifically, forensic nursing means when the nursing practice interferes with the law of the country, then that is considered forensic nursing, and the patient is known as forensic patient. We have seen this definition. Forensic nursing is the application of nursing process in public or legal proceedings and forensic healthcare in the scientific investigation related to trauma, death, and criminal activity. Now, basically, when we do forensic examination, we have to follow the 3 steps. The first is evidence preservation. The evidence is critical. That needs to be preserved. Then second comes the collection of all the trace evidence. Yes, these are minute. These are very small, but that gives a very significance. Then diligent documentation. Proper, careful documentation needs to be there. It is important. We should remember the central focus of forensic nursing examination is that truth should prevail. Justice should be given to both the victim and the accused. It's not that the always accused may also be not guilty. So justice should be given both the victim and the accused. And of course, we are all reliant to the society as a whole also. So next, The key points which we need to keep in nursing forensic examination is that we should not be in hurry. We should not be in any hurry to give any judgment. No judgment should be done. By seeing a patient, now you come across a patient who is totally drunk. You've seen he's totally drunk. He's having injury all over his body. Now what will happen? Suddenly a nurse can think that this patient is not worthy. This patient is not good. But the fact may be he or she might have been intoxicated. The victim might be having intoxicated by or forced to drink with his friends or colleagues. So no judgment should be done. Unbiased collection of evidence and documentation always helps in forensic nursing investigations. So these are the basic 3 steps which is needed in forensic investigations. That is evidence preservation, physical examination, proper interview of the patient, collection and documentation needs to be done. The first, the good, valuable skill which the nurse should possess, she should be very alert that this patient comes under the forensic category. She should recognize this. Yes, there is a doubt. Here I smell this case is a forensic category case. So that needs to be signified and a timely medical forensic examination needs to be performed. And always in forensic nursing examination, the first step is to find the nature and origin of the crime. What is the nature of the crime? Whether it is a physical, is it in the form of sexual or emotional? What was the origin of the crime? Whether it's in the form of accidents, neglects, violence, torture. Because we should also need to find out when the crime has happened. As the time of crime passes, the evidence can deteriorate. We know DNA of saliva can deteriorate very rapidly within 48 hours. In cases of this sexual assault, at least forensic examination needs to be carried out within 96 hours to trace evidences. Forensic evidence needs to be careful and needs to be successful arrest for the prosecution of the crime perpetrators. Yes, if we don't go for a proper forensic examination, the guilty cannot be punished. Chances of guilty escaping the clutches of punishment is very high. As a nurse, a proper documentation and proper collection of all the evidence will lead that the guilty is punished and justice is given to the society. So evidence which is collected by any untrained professionals, destroyed or mishandled during the course of treatment, example by doing contaminations or wound site drainage, or if you have not followed a proper chain of sequence or custody while collecting the data, this will not help in the investigation agencies. It is always critical that the skin of the patients of forensic cases should not be washed. It should be thoroughly documented because it contains vital evidence for forensic examinations. Wounds of the drainage site should be properly handled. We should wear proper personal protective equipments, minimize handling as little as possible, always avoiding sneezing and coughing in the samples collected. So we should be very careful. It is always recommended whenever a forensic examination is carried out, we should wear proper surgical gloves and mask during evidence collections, and the gloves needs to be changed very frequently. And if in cases of any food, beverage or drug poisoning is suspected, vomitus is considered as an important evidence. Sometimes stool, urine samples also needs to be collected. Now there are 2 types of evidences, that is testimonial evidence and the physical evidence. Any form of oral or written evidence which is given to the police or in a court under the oath is known as testimonial evidence. It is a real evidence. When a person says that, I have seen that this person has done the crime. So he's directly giving direct evidence. So it's a direct evidence. Whereas physical evidences are the evidences which comes to a conclusion that this material was used for the crime. Any instrument used for the crime, that is known as real evidence. So these are the types of evidences. The trace evidences, any micro evidence, yes, it's a micro evidence, but it can be measured and it can be helpful for the forensic investigation. All the trace evidence needs to be properly collected and needs to be documented. This transient evidences, any transient evidences are the evidence where the chances of getting washed away, damaged, loss Either it may be due to intentionally or accidentally or by various environmental factors. So the factors may be any. So transit evidences like blood on the site of the skin can be washed, and this will not help to the investigation. Next, there are two types of evidences, individual and class evidence. Individual evidence, when any forensic investigation comes to a conclusion that this person has done the crime. It comes to a conclusion that this is the source of, or this is the person who has done the crime. Examples like DNA, fingerprints, and handwriting. And whereas a class evidences are the evidences which comes to a conclusion that this is the group of class who might have done the crime. So it denotes to a group of persons. Like if you see that, if a suspect is that the crime has done by a B positive person, all B positive. So here the group, the blood group maybe, it is classifying to a group of evidence. So that is known as class evidence. Conditional evidences are the evidences which we get from the site of the crime. The site of the crime, how was the site of the crime? What was the condition of the lights at that situation? What was the doors condition? What was the condition of windows on the site of crime? What was the position of the body? What was the position of furnitures at the site of the crime? All this needs to be, comes under conditional evidences. Now, circumstantial evidences are the evidence. It is not a direct evidence or real evidence. It is an evidence. For instance, an example, already madam has taken that. A witness says that I have seen this person has done the murder of this person. But contrast a witness who says, I saw a defendant entering the house, and then I hear a loud noise, and then I see a defendant coming out of that same house with a blood in the knife. This proves circumstantial evidence. Whereas real evidence is when a person says that I have seen that A person has done the crime of B. So this is the circumstantial evidences. Now, physical examinations, a proper physical examinations needs to be conducted from head to toe manner, or it can also be done toe to head. But proper documentation of all the injury marks needs to be done in proper area by using body map and wound chart is there. The entire body surfaces needs to be palpated to find out any areas of bruising which cannot be visible. So all the body areas also needs to be, and all the information which is gathered by the agencies like transport or anything, or the witnesses, all this information which will lead to that particular assessment. Yes, if it is a case of head injury, naturally we will go for a nervous system assessment. But this should not act as a distractor. We should also think other systems of the body also needs to be thoroughly, assessment needs to be done. The ability of the patient to remember all the details of the event, means whether he is able to remember all the details of the event needs to be noted down, and how he is cooperating at the time of evidence collection needs to be strictly noted down. Properly pre-evidence collection kits are available and pre-packaged units are there. Forensic documentation consists of written component, diagrammatic component, and photographic component. So some of the methods of collection techniques are picking. So whenever you pick, the trace amounts can be picked by forceps or anything and can send for forensic investigations. Then lifting, adhesive tapes can be rolled over on the surface where you see that there are trace evidences, and the trace evidences sticks to this adhesive tape, and this can send to be forensic investigations. Scrapping. This is another method of vacuum sweeping, vacuum sweepers. Vacuum cleaners are filtered with filter traps, which will help to suck all the trace evidences, and it can help in the data evidences. Combing is another method of data collection. Clipping is also there. Yes, forensic nursing investigation basically consists of 3 steps. That is, we have to preserve the evidence. We need to preserve the evidence. We need to proper physical examination, proper interview of the patient needs to be done. Proper collection and documentation needs to be done. Because if we do a proper examination, then naturally the truth can prevail and justice can be given to both the victim and the accused and the society as a whole. Yes, the healthcare professionals were once not considered to be part of the investigative team, but forensic speciality has helped to bridge the gap some extent between the medical and legal cases. Thank you.
Thank you, Professor Binujo, for wonderfully explaining that how the forensic nurses should go ahead with the forensic nursing examination and the importance of the each and every step, and how the documentations can be done. Now, the next step is in this examination is the photography. How the photography can be useful in the photo documentation. Dr. Suresh Kumar Sharma ji, he will explain that what is the importance of that and how that can be done. Dr. Suresh Kumar Sharma ji.
Thank you, Dr. Rakesh. Dr. Binu has beautifully explained the forensic examination done by nurses. We have seen in morning, probably you have seen yesterday, that when we receive a patient or a victim in an emergency, they require a thorough examination and documentation. We have seen medico-legal cases coming to emergency and trauma centers, and we have a shortage of forensic experts in not only India but everywhere. So the need was felt that we can have nurses trained into forensic specialty so they can play a pivotal role into this. Now, the importance has been aided by a new emergence of a problem that is sexual assault, which was lower in India, but now it is in rise. We have domestic violence, and we have child abuse and elderly abuse. These medico-legal cases are coming to emergency day in, day out, in addition to the common traumas which are happening on roads. Dr. Binu has highlighted that whenever we are examining these victims or patients in an emergency, the careful observation is very important. However, there may be individual difference and subjectivity into observations. So when evidences are produced in courtroom, they will ask objectivity into the report which has been presented. And most of the time, emergencies are where there is a hurry and worry and there is a hustle. So the observation and documentation may lose the originality of the particular evidence. So photography has been added one of the component. However, photography is done on the patient, and at times it is involving very private parts, specifically into sexual assault, where the photographs has to be clicked from private parts like breast and genitalia and perineum. So what is most important? In photography, most important is consent from patient. We have clearly drawn laws in country India where when the consent to be taken from patient himself and when the consent to be taken from his relative or the legal guardian. So in case of minors, when someone who is not been adult now, that is the 18 years age we have now cut off. So the legal guardian has to give a consent, and the assent also can be taken from a child who is able to give that. And from an adult, a consent must be taken before we click the photographs. Photograph must be taken by a clear, the good quality camera, so evidences could be of good quality. Now, second most important is how to store these evidences. This has to be stored into private, password protected place and not at a one place, because these evidences are evidences related to legal matters. People may intentionally destroy it, or there may be technical problems because of that these evidences may be lost. So we must preserve this at more than 2 places which are protected by the password. And second, the third important component is releasing these evidences. Who should have this evidence once it has been collected by the nurse examiner? This should not be given to anyone without consent of a person whose photograph is this, at every level. In US and other developed countries, there's a law defined on this. In India, we have a law that yes, consent must be taken from a person. Now, second thing is, who can have this information? To whom it can be released? It can be released only on the court orders if this case is related to legality or crime involved into it. Without that, it should not be released to anyone. And second most important thing in this is that a consent, the approval must be taken from a hospital authority before it is released to any agency. Consent of a patient, approval of the authority, and a order from a court. These are the three things which are important for these, photograph evidence or photograph documentation to be shared. Now, some of the important things which I want to highlight when we click a photograph, it is not only the consent of the patient, but we need to reassure the patient. And patient must be very comfortable when photographs are clicked. And assurance must be given to patient that this photograph will be kept for these purposes, and purposes has to be first in hand told to the patient or the person or victim that these are the purpose for which these photographs are clicked, and then they are followed accordingly. So with this, what I say that photo documentation is very, very important into these medical legal patients and victims, and nurses can make use of these photo documentation. They are very, very important to prosecute the culprits. However, there is a ethics involved into it and legality involved into it. This we should keep into mind, and we should not loosely do it and keep it, because otherwise it can be misused by anyone. And in India, there's a very fragile law about pornography, but in a Western world, there's a strong law about pornography. So if a victim who is involved into pornography is a legal pornography, and now this person comes as a victim, there's a diagram on how to click this and how to preserve it and how to release it. So I won't speak much about it because this is in a very gray area in country India. That's all about photo documentation in these victims. Thank you so much.
Thank you, Professor Suresh, for showing the need of the photo documentation and some of the legalities of the photo documentation in India. And this photo documentation, of course, what a photo can tell and what a person can tell. So there is a vast difference. A person can speak a lie, but a photo will not speak a lie. So the photographic evidence, that has got much importance, but only if that in a proper way and proper things. But as he has said, that this time is too short to go into all those details. And we may discuss it at some other time. Now, I will request Dr. Raman Kalia ji to please shed some light on the topic of discussion today. Dr. Raman Kalia ji.
Well, good afternoon, everyone. After listening all the co-panelists, I hope the audience must have learned many new things today. As far as forensic nursing is concerned, we all are aware that it's a newer area, a newer subject and a topic of discussion. As many new diseases evolve in the country and we learn management of those, the example COVID we had recently, and we all learned. Similarly, as Dr. Suresh said, these days, since the type of assaults, the types of violence, and these things are emerging more, so the need of learning forensic nursing also has increased. And in the recent syllabus, we have seen integration of forensic nursing in the curriculum, which was not there over the years. And many of us have not been trained like that. When it comes to teaching of forensic nursing to our fellow students, we'll be now implementing this curriculum based teaching. Another thing important is the competency teaching for collection of specimens. We have learned and taught all through the years the sample collection of ordinary patients. Now when we collect samples for forensic evidences and other things, probably this also is an area which has to be added in our education system of nursing. In the new curriculum, we all need to learn this and train our students to take up this area and learn how to practice forensic and how to contribute towards the evidences, because these are very important aspects when it comes to the handling of the cases. So the module of forensic nursing in third semester now in the revised syllabus is going to give some education to nursing students on this so that they can later on learn, practice the skills and all. This is one area which was earlier lacking in our syllabuses. Now we will be coming up with the forensic nursing education and the students will be trained in that. That is one aspect. Otherwise, in our country, as all of us know, that nurses have got so many role conflicts in themselves. So when it comes to handling of any evidence or any patient, one has to be very, very clear and specific, as there will be many people handling the situation. The one who is responsible for collecting observation, it starts from nursing process itself. The examination, collecting evidence, collecting data, preserving the things, and one has to be very, very clear in the objectives, carefully manage the situation in spite of all the disturbances around, so that the valuable clues at the time of receiving the patient in the emergency or first interaction of a nurse are not destroyed. Many times this happens. In many cases we come across later that the evidences are lost during the medical care. So for the nurses, this also becomes one very important area to keep the evidences intact. And as we are seeing the emergence and importance of this topic, the topic chosen for this conference today is very, very new, and this as per the need of today. Since the subject is like that, so this is very well chosen topic for the conference in terms of advanced practices in forensic nursing. Now is the time that we have to teach our students and practice more and more forensic nursing. And advancement of this will come maybe in near future if we see, as we said, we'll develop guidelines for ethics. We have to develop guidelines for forensic practices, and we might come up with the specialty of post-graduation in nursing, in the specialty of forensic nursing. That also is going to be very nice, because otherwise, if you see forensic, you read news or you listen to the TV shows and all, this subject is very interesting and is very challenging. You feel interested in following the case, following the evidences. So this is going to be one good opportunity and a career advancement in nursing if we come up with a maybe post-graduation in few years. Indian Nursing Council thinks of this, introducing as a post-graduation specialty. I think it is going to be an interesting subject for the future generation. But as an educationist, today I feel that the students who have been admitted now, when they'll be in second, third year, even the subject teaching for all of us and learning for these students also is going to be quite interesting. Maybe till then we will see more advances. That's how I feel forensic nursing as a subject, a new and an interesting area and a topic for us in the country. Thank you.
Yeah. Thank you, Professor Raman Kalia, for your views on forensic nursing science and how this should be done. Before I sum up, I will invite, because the time is running short, so I will just invite 3 questions, not more than 3 questions. If any one of you have any question from the panelists, 3 questions. First 3 questions are allowed, please. If you have, yes, please, ma'am. Just after that.
Hello.
Good afternoon, sir. Good afternoon, ma'am. It was very informative about the whole discussions, what we heard from every one of you. But my point of concern is how much we will be putting into practice, because we are all lay people to forensic nursing. As teachers, educators, administrators, the knowledge we can get is theoretical, practical is zero. And as per the INC syllabus, we have got our exposure in the forensic department. We got emergency department, forensic lab, police administration, witnessing court proceedings, and toxicology unit. So these are the practical aspects not yet put into practice, not yet given any guidelines, how we should implement it, and how our students going to learn, and what is the force we need here. If I tell today to my students to go to the police administration department and put a practice over there, nobody will agree. We are all more on the theoretical base, but definitely when we are in the hospital, we need to be more practical oriented. So we definitely need some good guidelines on the practical aspect, so that when this subject comes up in the semester, in our BSc nursing in the following months, we should not follow the same old practice where, students don't do anything, they just take lectures and they finish. Forensic nursing is over. So if we are really putting a trust, and we want to make it a good impact in nursing profession,
So we got you.
I need your help in this.
I got you a question, ma'am.
Yes,
And
thank
that
you.
is the very relevant need of the day. If you permit me, I will suggest the practical ways, how we can do that. So the students are in the second semester, and they will be learning forensic nursing science in the 5th semester. There is completely 1 year with that. There are many online courses, but knowledge, I think, is everybody can inquire. The Google helps it so much. We can learn anything if we have the desire. The important part is you are talking about the skills, that how the skills can be developed. Probably wherever you are, if you are in a position to do that, various persons sitting here have different positions. Some of them are in the administrative position, some are not. So those who are in the administrative position, who can take the decisions. So one member of their faculty or one of the nurses, they should label them as forensic nurse and put them in the emergency. And in that 1 year period, the doctors who are doing the forensic medicine work, they should get involved with them in the academic matters. And then they should learn from them. This is a shortcut. Other ways, of course, the degrees will start, and then gradually the learned persons will come who will be having the knowledge and the skills and the attitude and the aptitude and the communication skills. But till that time, we must label one nurse as a forensic nurse, put them in the emergency. I know many of you can do that. Many of you can do that. Administrators can do that. But sitting here, right here in the this Akal College of Nursing, so whosoever can take the decision, I will request that person that at least holding this conference will be only of use if it is done something practical. Probably I will request Chancellor Sir to go for the MSc Forensic Nursing Science in this institute. I will request Chancellor Sir to just name one nurse, either from the faculty or from the general side, in the emergency department, and label her or label him as a forensic nurse, and so that the trend starts. So this, what is being done here in Akal College of Nursing, this can be then replicated in many other colleges. Many of you are principals sitting here. I am meeting all of you. Probably at least in your college, in your institute, you can do this. and label them forensic nurse. If possible, it should be round the clock. If not possible, only during the morning hours from 9 to 4, that can be done. And she will learn, and then she will teach the students. I assure you, she can learn it very quickly, and she can impart the practical knowledge to the students when they will come after 1.5 years or 1 year. So this is my suggestion, and wherever possible, start MSc, wherever possible, start diplomas of forensic nursing. So this is the practical solution. If anybody wants to add something, I'm most welcome.
Whether only putting in emergency any nurse is enough to get practice in forensic nursing?
No, it is just, there are two ways. One is getting degree. One is already who is a nurse, we can teach him, you say by short courses or by getting them attached to the forensic medicine department and forensic physicians, they can learn it and give them some knowledge also. I have done at Gyan Sagar Medical College, so this had been a very successful model there. We had been doing.
One suggestion I will ask to Sharma sir. Sir is from government actually. So we could have haven't taught on this also, teachers training on this forensic. So first we need to teach our teachers now, then only they can teach to the students. Theory is also not so much good, madam, for the teaching this forensic nursing. So that also we needed. As sir is in the government, I just request sir also that this point can be put with the government sectors. Yes, we need to teach our teachers also on the basis of the theory, then we could have asked about the practice also.
Definitely, I'll take up this message to Nursing Advisor to Government of India, and also we'll talk to Indian Nursing Council authorities if something can be done. But you know, the magnitude is so large of nursing institutions and faculty. Training hands-on is a very, very tedious task. I just want to add a couple of things. You know, for anything, the journey has to begin from zero. We may not be knowing something today, but we have forensic medicine experts with us. We can take help of them for practical training initially for students, and I'm very much agreeing to what Dr. Rakesh said, that we can identify a faculty or a nursing colleague who can be part of shadowing initially, and gradually he or she become expert and then can become a resource faculty for us. I think that's the way we will build it so strong. Initially, it may be a little weak, but once we have begun, these nursing graduates are not going to be specialists as a forensic expert, but they are just going to have an idea what forensic nursing is. And then they will be ready to take up postgraduate or postgraduate diploma courses. And for postgraduate and postgraduate diploma courses, we need to have a very strong clinical expertise for them. And I think over the time we will build it. And I will definitely take up this message to Government of India and to Indian Nursing Council, where what we can think and we can bring out so that we can have a faculty capacity building into forensic nursing. Per se, the practice is concerned, not the just knowledge.
As such, this SGT University is taking all the things in the simulation-based training. Now it is going on. So many are going with this SGT University. This forensic training also can be done by this. At least we could have started.
Yes, this is a good idea.
Yes, so
I'll take this up and we'll see how it can be rolled out.
Two things are there, sir. One, taught for the forensic nursing means every teacher must know. As in the we have biochemistry, we have biophysics, so many subjects we are taking external from outside. Here also the suggestion is there we could have taken external. But why external? Why the nurses are not getting teaching about this? So taught is important one thing, and the practice we could have used simulation as SCT is doing for the forensic. This is also one good thing. Then we could put in the emergency ward and other places where they can get the practice well. I think so. Yes.
No, I'm a little partially disagree with, because nursing is an applied science and it's an interdisciplinary education where there is no harm of taking expert help from anatomy, physiology, biochemistry, pathology, microbiology, pharmacology, and forensic nursing.
But we need to learn
forensic medicine. But I agree that we need to have our own acumen, because forensic nursing will be slightly different from forensic medicine. So initially we'll take help from our medical colleagues, and gradually we will build it as a resource.
Yes.
That's only the way. We don't have any quick fix immediately.
Yes. Thank you, sir. Thank you so much.
Thank you, Dr. Suresh, for your valuable input. Sir, wish
One
to say
question I
something.
have along with it.
Chancellor, sir,
Yeah.
please.
Thank you very much, please. I think we have to keep this in mind that we are still in this infancy. The curriculum has just been introduced in the nursing course. So we have to take baby steps first. I'm sure if our nursing teachers could teach anatomy, pharmacology, and pathology, they could very well, very easily master the forensic science as well, and they could start teaching. I accept the proposal which Dr. Goria has just said, that we could start MSc nursing here. My only concern is that for the last couple of years, the trend in at least Himachal is that students are not going for master's programs, they are preferring to join jobs. So as such, even for the medical surgical nursing or for pediatric nursing or for midwifery, students are not opting for master's courses. I'm not sure how many would like to opt for the master's course in forensic science. Second part is, but we would start, as per your advice, we would start that course. My second suggestion is that we could pass a resolution today that we approach the state DMREs and request them to start a training program of, let's say, 10 days in the medical college for our nursing students. If they could visit those departments for 10 days, see what's happening there, I'm sure they'll learn a lot. And similarly, like a center like ours, which is so peripheral, if the DMRE or the medical college principal or the state government, they could be approached, we could pass a resolution today that if they could be approached to allow our nurses to join the emergency wing there for a couple of months. I'm sure that will also go a long way. Like you said, the emergency medical nurses. So could we just pass some resolution today and then we approach the state governments that this is what we need? Thank you, please.
That is a good idea that a resolution is passed that our one nurse, say from one faculty member from each college, probably they can go ahead and can have a practical training there, from there in the government institutions, because most of the medical legal work is being done in the government institutions only. And I will say that in today's world, it is a teamwork at most of the places. So we should be ready to work in a team where the forensic physicians are there, where the forensic nurses are there, where everybody else is there, whosoever is required. So then that will be good. Thank you, Chancellor Sir, for your positive approach, and I think we will go ahead with what you have suggested. Professor Sandra.
I just have comments. I don't have a lot of questions, but thank you all, and this is a great resolution to begin with. I keep coming back in my mind to the word unworthy, and I think it was in who do we deem unworthy? And this is, I'm just talking conceptually. I'd like everybody also to think about our biases in our life, our bias, and sometimes we have a lot of bias. It affects us as nurses. It affects us as care. So as part of our learning for young and blossoming nurses is to think about implicit bias. I teach some of this in a course I teach, and it's wonderful to have nurses become aware of what they're not really even aware of, things that are biased inside of ourselves when we learn from our environment, from our home, from our community. Sometimes things are there we're not aware of. So to bring a bit of implicit bias into the ethical aspects, and maybe a pre and a post, I have that information to help students become more aware. And this addresses a colleague here. And she brought up an example of the growing number of sex workers or people that, you know, marginalized groups, GLBTQ groups. You know, when we have people as patients, we might have bias that we aren't even aware of. That was my first comment. Somehow to bring into the ethics the bias. I love that strong ethical slide, and I spoke with my colleague here, and I asked about the Indian Code of Ethics. You have an Indian Council Code of Ethics, correct? So it really matched that, and that's another thing to really begin with in your curriculum, to understand your ethical codes as nurses and as a society, and then also to understand biases. And then moving forward, my next thought is, in terms of training, and everybody had such great ideas, with very little, almost no equipment, you can do short simulations, you know, where students act out these things, and one becomes a patient, and one becomes a police officer, one becomes an ambulance driver, one is the patient, and you go through the practice and observation, and the faculty give not a punitive evaluation. It's not a plus, oh, you did this right, you did that right. It's more of a discussion, understanding, a discussion to kind of process your thinking. You can do great. My mind is, you don't even have to have a simulation lab for this. You can do it right here. Short little things, and even my thought was with the collection of specimens, like you went through how important it was, even to do just that, 1, 2, 3, 4, and to focus on that, because we all know that simulation is great. I'm not talking about fancy things with mannequins. I'm talking about just one-on-one. And it's a great tool. It's easy, it's practical, and everybody can be involved, even an ambulance driver. So those are my comments, and thank you.
Thank you, Professor Sandra. Yes.
I just wanted to add
Please.
one point, sir.
I think now we are running short of time.
Very important for our nurses over
Just
here.
2 minutes. Please go.
If you can help us in formulating a module on the practical skill aspect, that will sure give a lot of support to us in the nursing field. And we will be understanding how to put the practically aspect. That is the main concern, because when we are working in the areas of clinicals, we are law binding to our students.
You have a very right concern that skills are required, And I think under the banner of the Indo-Pacific Academy of Forensic Nursing Science, we can develop some of that program where we can do the teachers training program, as well as giving them the skills who are interested really to go further ahead with this. We will do that. So that is a good suggestion. Ma'am, you want to say something? Just 2 minutes, please.
Well, sir, as you yourself concluded that we have so many resources online available, sir also said we can ask government to give us opportunity to visit certain places so that we can orient our students to this. But all these are very, very confined and medico-legal aspects where all the people cannot be exposed to in the situation. Well, as educators and teachers, it's our own judgment. We also have to take effort and think of resources, how we can make resources for teaching the students if it's a new subject or a new topic. We have been teaching students many congenital defects with the help of photograph. If we can photograph certain areas with due ethical considerations, maybe a lab or a visit of students, we can give them to give field reports. They can visit various areas and give field reports and learn. Gradually, we can make our own resources rather than expecting that the curriculum has been based and somebody else make module. We ourselves have to make modules. We ourselves have to learn how to make resources for teaching our students if the topic is new. When COVID was new, everybody learned. We learned, all of us, and we managed. So if this is a new subject and a new topic coming across, we all can learn from various sources, various agencies. Bit by bit, we can build up materials for our own students in our own possible way. The practical ways, very simple practical way is appointing a nurse, as in any hospital, or it can be done. Similarly, in all government institutions also, somebody can be placed. Gradually, they will learn. They can have their own small workshops, 4 or 5 people in service education in every government hospital, private hospital, even our colleges, 3 or 4 colleges can get together. We can make our faculty share ideas, learn, become resource person for each other. For everything, we cannot be demanding somebody else makes modules and we will teach. We also have to take certain initiatives ourselves if we think the subject is important. That's what I feel. Everything has to be our own willingness in accepting and learning. That also is very challenging for us teachers.
Thank you, Professor Raman, for your very valuable input that how we can do that. As we are running short of time, I will like to conclude this panel discussion. So what during this 1.5 days, in these 2 days, we have learned a lot from each other. And now the thing is putting that into practice. Wherever possible, designate some nurse as a forensic nurse and let that forensic nurse be attached with a forensic physician in the beginning. Let them learn some entry cases, some skills from them also. Because wherever, even in the USA, when it was developed, these were the forensic physicians who came forward and started developing this. I know one, Dr. Peter is there, so he's always there in the forensic nursing science conferences. There, he's a forensic physician and he's always helpful. And he has been mentioned so many times in the conferences that initially he helped to develop the forensic nursing science. Similarly, we should not be hesitant in India to have the collaboration with the forensic medicine people. Put our resource person, say we have nominated one nurse as a forensic nurse, and let him be posted with that forensic physician. And gradually, in 2-3 months' time, that person will learn the intricacies of what is need to be done. And we have also to take care of the laws of our country, because in India, still the laws needs to be changed so that the forensic nurses can take a bigger role. But we have to do whatsoever is present today with the present facilities, with the present resources, how we can move forward. So that is the practical way to move ahead. And I will say that no forensic physician is unwilling to teach the skills which he has. So take the help from them, be a part of the team in the beginning, and then gradually this will become a separate discipline in itself, and separate professionals of forensic nursing science will be there. Probably there are so many people to help. We had the organization in the beginning in the forensic nursing science. Probably half of them were the forensic physicians who are in this organization, and they try to help. But those persons who are seeking help, their number is less. The persons who want to give help, their number is probably more. So probably go ahead, and once you learn this examination, in the examination, as has been told, the most important part is consent. That without consent, never do an examination. And if the person withdraws consent even during examination, then you have to stop the examination there and at that time. So that is the level of the value of the consent. So this is very important. And once you know how you are going to assess, how you are going to know what evidence needs to be collected, you collect that evidence, you preserve that evidence, and you pack that evidence, and then there is a chain of evidence and that you maintain. And in this process, Professor Suresh has told about the photo documentation. Photo documentation is very, very important. Previously, it was not digital. Now it is almost digital photo documentation. So in the digital photo documentation, one thing I will say, there are two important things. One is keep the scale always in the photo, and always preserve this evidence in a raw form. Always preserve the data in raw form. That is only accepted by the courts if it is in a raw form. If it is even slightly modified, it is not accepted. So keeping the scale, keeping it in a raw form. And sometimes even with the ordinary cameras, you may not be able to get the evidence. Then the ultraviolet cameras and infrared cameras are there. So what the eyes cannot see, what the ordinary cameras cannot see, they can see. Even in those hidden things. Even if I have given a slab and if I take with infrared, so the marks are going to come, it may not be visible to the naked eye. So that is the value of the photo documentation, and whatsoever we do, that needs to be done ethically. Everybody, ethics needs to be listed. This is for those people who are not clear in their conscience. So there is brain, there is mind, there is soul. Your soul always knows what is right and what is wrong. When you are doing something wrong, something will come in the mind that it is not. But mind say it is okay, okay. And the brain will say, yes, you are getting a profit order, go for it. Listen to your soul. Always listen to your soul. Will always tell what is right, what is wrong. And once you start listening to the soul, probably, what are the ethics? These are what our soul is saying. That are the ethics. What people expect, what we expect from each other. So these are the ethics. So go ethically with that. And once you go ethically, once you have the knowledge, once you have the skills, when you develop the aptitude, and you get the right attitude, you get the right communication skills, and with your mind, brain, mind, and soul, everything is going to be on the right track and on a fast track. So with these words, we come to an end on the panel discussion, and thank you very much.
Thank you. Hello. Thank you, sir. I just want to wrap up, Dr. Goria. We want to salute this man for he's remained committed to the cause of forensic nursing. And only one thing, what he said, I think, which envelops everything, that listen to your soul. So beautiful word, and I think it's a takeaway for all the young nursing professionals. One is that we are sensitizing them, and then we are giving them the voice, the forensic nurse. Like the forensic expert has a voice in the legal system, but I think we should also give voice to the forensic nurse, so that her evidence, her observation is also important. Because it's not only that she's recording, because everyone may be sensitized, may be trained, but that person has to be given voice and given credibility by our judiciary. So thank you very much, sir, for being here and being committed to this cause. Thank you.
Thank you very much, everyone. Thank you, sir. Okay. So our panelists wants a group photograph of the panelists. So is somebody there, photographer? Yes.
Thank you so much to all the respected felicitator of our panel discussion. We are sure that this panel discussion and the steps to be taken for forensic nursing and nursing update, definitely it will going to help to upgrade the level of our nursing profession. Thank you so much once again, felicitators. So now we have our special honorable guest with us on the day. We request the honor of your presence. We invite you to share with us a celebration of love and respect.
For that, I would request Dr. Baba Davinder Singh ji to please come and honor our special chief guests, resource persons. And I would also request Dr. Neelam Kaur ji to please honor and give the token of love to our chairperson, special guests, and resource persons.
I would like to invite our special honorable guest, Dr. Suresh Kumar Sharma ji from Principal AIMS, Jodhpur, Rajasthan.
I would also request Principal Dr. Anupam ma'am to please join the stage.
Dr. Raman Kalia ma'am, Principal Saraswati College of Nursing, Roped, Punjab.
Now next, I would request Dr. Binu Joy, resource person, to please come on the stage. Principal Christ College of Nursing, Rajkot, Gujarat. Now I request Dr. Jyoti Artiwari, our chairperson, Principal College of Nursing, Chandigarh University, Punjab, to please, ma'am, collect her token of love.
Dr. Deepak Kumar, Principal, Abhilashi College of Nursing. Dr. Raghunandan, Principal, Murarilal College of Nursing.
Next, Dr. Bala Subramaniam, chairperson, Principal, Ambika College of Nursing, Punjab. Next, Dr. Leela Verma, chairperson, retired principal, Shimla.
Next, Dr. Sudharani, Vice Principal, Ambika College of Nursing, Punjab. Dr. Simajit Kaur, Ames Batinda, and ex-faculty of Akal College of Nursing at Allen University.
Now next, with our special guest, Dr. Kamla Tanwar, Principal, IGMC Shimla. With her next, Ms. Prem Lata, Nursing Superintendent, IGMC Shimla.
Revered guests and hopes of humanity, my dear students, we finally come to the end of this session. I take this opportunity to thank one and all who came here, especially Dr. Jill and Dr. Friedman, who transgressed time zones and continents to be with us today. Let's remember that she is 85 and still full of energy and gusto. We all need to take a leaf from her admirable capacity and resolve today that age is just a number. We have to carry on and on and on till our last breath in service of humanity and society. That is the message we take today. Also, whatever little humble abode we had here, it was at your disposal. I'm sure that it may not be up to the mark for many of you, for which we seek our apologies. We really appreciate that despite the damage that was caused to the campus here, which could be a great deterrent for everyone. And also the damaged road from here to Rajgarh. So many people, such galaxy of nursing minds have reached here. We are indebted to each one for their presence here. And for the young students, budding nurses, please take this message as you go back home, that nursing is a spiritual profession. Your love and compassion that you shower on your patient would go a much longer way in providing healing to the patient than all the medicines that the doctors can give. Also, time has now come for the nurses to stand on their own and not holding the tailcoats of the doctors. You are professionals in every respect. Please stand up to the tasks ahead. I am sure that the deliberations that we had today, especially starting out the MSc nursing programs, I would request many of you to take up this profession, because sooner or later, this is bound to become a separate specialty in the field of nursing. And the ones who take up the cudgels today, who do their masters today, they would become pioneers and leaders in the field. It will be a virgin field where you would all be welcomed. One last thing that I think in the last panel session, I would just add that in some of the universities, we have an MSc nursing MSc forensic science program also. So we could think of engaging services of those graduates to begin with, to teach our students. With these few words, I thank you all for visiting this Valley of Divine Peace, with the request that please come and enlighten us with your wonderful knowledge and your experiences every year. This is an yearly conference. If Dr. Jill and Friedman could come all the way from US, just for 4 days they have come. They're flying back on 17th. I'm sure all of us could come again and enlighten us. Thank you very much, please. Thank you.
Hello. Greetings to everyone. May I call upon Dr. Jill, Dr. Sandra, and Dr. Goria, Sureshji, and all the principals of the nursing college and the senior management. They are representing their organizations. Like we discussed yesterday, that we all want to pass a resolution like we discussed yesterday about the sexual offense being committed on the women, which is called as rape. So instead of calling that so-and-so was raped, so let's all like pass a resolution that instead of calling it a rape, we should call it that so-and-so man, Mr. X, whosoever, he disgraced or he dishonored himself, so that the female is just the recipient in this, not an offender. So this should be named, so I request all the heads of the institutions to come here on the stage and we take a pledge. And we all can read that pledge. And may this be a start of a social reform. Though it may take years, we don't know when it will be renamed and when will this reform really be a part of our society. But I think there's no harm in starting that. So I would request all the principals and our visiting faculty and last of all, Chancellor Sahab, Dr. Devinder Singh Ji, also to come on the stage. Thank you. Next stage, yeah, you got to be in the center. Yeah. Would like to read, get someone to read. Dr. Goria can read this and we can all like
So we all take a pledge for the betterment of the society, for betterment of the women.
We all take. Excuse me, sir. We have to repeat after you. Sir, is it to be repeated after you will say? Right, wala.
Just charge it and restart it. No issue. So there are always hurdles when we want to make some progress. So this is just the beginning, and to our what we are going to resolve. So this is just the beginning of a journey to the top of the hill. So we are just sitting at the bottom, but somewhere someone has to start, and we are very much pleased that this is being started at Peace of Valley of Peace, sorry, at the Akal College of Nursing, Eternal University. And what we are going to start here, probably it is just like throwing something, a stone in the ocean, and it is going to create ripples. And ultimately, those ripples will be the bigger waves, and the bigger waves become tsunamis, and they always bring the change in life. So we are seeking a change in life of the women, of all the ladies, all the girls, all the small children. Because we see that in the daily lives, when someone is brutally attacked, it is just not the physical hurt. Physical hurt will heal very soon. But what the actual hurt is here. So that many of the victims are not able to shed away throughout their lives. So, because the term which is there, rape, it is a sort of social stigma for the fault of somebody else has to suffer. Why this should happen? That always pinches in my mind, that why all this, somebody has done something wrong, but the suffering comes to some different person. And you are going to become the true servants of the society because you are in such a good educational institution where they just not only teach you the science of the nursing, but they are also teaching you the values which are not being imparted in many parts of India, and I can say in many parts of the world too. So this is a great experience. This is a unique experience for you. Okay. Yes. So we take a resolution, all of us who are present here at the end of the 10th International Conference of Akal College of Nursing at Eternal University, that we all present at the 10th International Conference on Advanced Practices in Forensic Nursing stand committed to the cause of value-based and moral education to be part of all higher education disciplinary studies. In the lines of this, the act of sexual offense committed on female, which is named as rape, should be renamed as dishonor or disgrace committed by a man in lieu of being reported that the said female was raped. It should be recorded or reported as male X dishonored himself in the eyes of the victim and society female recipient. We all stand together and start this as social reform and our commitment to build better, sensitive, empathetic, and caring humanity for tomorrow. Thank you very much. Please have a photograph so that all those who have committed, they remain committed throughout their life. Thank you very much. I just tried to pass on the time.
Thank you, everyone. Now the time for certificate distribution. Sir, please stay back. Doctor, sir. Prize distribution. One Modern Nursing College. Please come and collect your certificates. Okay, I request Dr. Jill and Sandra ma'am to please come on the stage for certificate distribution. Dr. Jill and Sandra to please join for certificate distribution. Any representative from Modern Nursing College? Please come and collect your certificates. Two, three more students can come along. Hurry up, please. Modern Nursing College. Next, Lord Mahavira College to please get ready.
After Lord Desh Bhagat College of Nursing. Lord Mahavira College of Nursing. After them, Desh Bhagat College of Nursing. Please get ready with the sequence. After Desh Bhagat, after Desh Bhagat, Godavari College of Nursing. After them, Samarpan College of Nursing. After Desh Bhagat, Godavari College of Nursing. Samarpan College of Nursing. Hello. From Godavari College of Nursing, all the students can come on the stage. Godavari. Please give a big round of applause for Godavari College of Nursing. They have been traveling from a long way. Our special thanks to Godavari College of Nursing to join us. Thank you so much. Faculty member from Godavari College of Nursing are requested to join the students on stage, please. Can we give a huge round of applause for them because they have traveled so long to join us here. Thank you so much once again, Godavari College of Nursing. Can we have Samarpan College of Nursing on stage? Samarpan College of Nursing. Any representative, faculty or students? Hello.